Welcome to another episode of Living Life Out Loud with your girl Size Speaks, a podcast and series of videos that give you 20 minutes or less of hope, inspiration, love, laughter, and overall dopeness as I share my life as I battle and thrive with chronic kidney disease. So let's talk about my new adventure, right? As a kidney disease warrior, there are specific medications that are pretty standard for me to take. And one of the things that someone who is at stage 5, in stage renal disease, we take binders before we eat, whether it's a meal or a snack. And the binders kind of help to control the level of phosphorus that our bodies absorb, because when your kidneys are compromised, if you have too much phosphorus in your body, there's some really horrible side effects. Intense itching. One of the more serious side effects is, your blood, arteries, things like that. They harden, and because the calcium levels have just gotten really high and out of control, and so we need some help when we're eating food to ensure that everything that we ingest will keep the good and expel the bad. And that's the wonderful thing that our kidneys do. One of the many benefits of healthy functioning kidneys. But when you are battling and thriving chronic kidney disease, especially towards the stages 4 and 5, you do need some assistance with this process. So before, I would take Tums, just regular Tums, every time I eat. If I had a meal, I would eat two to three to make sure I was covered. And if I had a snack, I would have one. But my doctor, my nephrologist, the kidney doctor, was noticing that as I was consuming the Tums, because of the frequency, it was causing my calcium level to spike up and be too high. And like I mentioned earlier, that can be a problem for myself, as well as it was just causing some digestive challenges. So he put me on a different medication. And the medication that he put me on, the first 2 months, he provided 2 free bottles, which was great. But he did eventually call in a prescription for me. And the pharmacy actually called me today to pick up the prescription. But, the lady said, well, I just wanted to give you a heads up before you got here how much your out-of-pocket expense was going to be for this medication. Now, mind you, it's 30 tablets in this bottle, and I take anywhere from 3 to 5 per day. So I would need at least 60. Now, she called to tell me how much 30 tablets would cost me. And she told me it was $1,600. For 30 out of the 60, it was $1,600. And I would need to take this every month. So you do the math. Now, mind you, the medical insurance that I have is, because I have end-stage renal disease and I'm on dialysis, so they are well aware of why I'm on this particular why I have this type of medical insurance. And any series of prescriptions that I have in this particular order is necessary, to say the least, to ensure my overall health. Now, when she gave me the number, of course, I was like, no. Now, I wasn't surprised because the number says $1,600, because this isn't the first experience I've had where a medication that I needed for CKD, short for chronic kidney disease, the pharmaceutical companies have price gouged it, because what they have realized, when you have a chronic illness, there are certain medications that are standard across the board, and they are considered essential for the health of the person battling and thriving with that particular illness. So they make their money off of individuals battling a chronic illness. And you would think that they would work with, the patients, the healthcare professionals with a lower cost medications. Absolutely not. The prices have been out of this world. So I want to say shame on you, Big Pharma. Like, it's ridiculous. It is atrocious how they price gouge and how they do things that just shady practices. It is clear that the health of the patient is not a concern. They don't see that this medication could be someone's lifeline. All they see is a dollar sign, because there is no way in 2020 a medication should be $1,600 that is not some type of cosmetic vein type of medicine. This is something considered essential to a person battling kidney disease, something that he or she needs to take daily, multiple times a day. There's no reason why that medication should be $1,600. But because we have greedy people looking to capitalize on people unfortunately having a chronic illness, this is what we face. This is what we deal with. I am never surprised when I go to pick up a new prescription when the number is 100 plus, because this is what they do. I'm actually surprised when it's low. I'm like, you sure you want to run that over? I just want to make sure. I don't want to get something and then come back and I have a bill. So yes, on this journey, we see it all. It's like they say, oh, so-and-so has been diagnosed with this, cha-ching, and it goes from there. Any and everything. That's why when my nephrologist tell me, oh, I want to try this new prescription, I'm like, no, we're not going to try it, because that means somebody else's pockets is being padded and made fat off of me. And I'm not in the business of keep making other people rich. I want to find a way to keep my own money and watch it grow, multiply, and increase, and, help a few people in my community. But yes, $1,600 a month for a 30-day supply of a medication that I actually need 60 days, because I consume 3 to 5 of those tablets a day. $1,600, 1600, just for 30 days of a 60-day supply. And without them batting an eyelash or feeling any type of like, oh, it was a mistake. They was like, no, that's what it costs. So there's no cushion, there's no assistance. So that's the flip side. Even though it's considered essential and critical for my well-being, my medical insurance feels like it could be something else they can give me, like something of cheaper value, even though this particular medication has been proven to work best for my body, my levels, and they're seeing it swing in a positive direction. My insurance was like, well, we're not going to cover it. She's going to pay full price, which is $1,600, which shouldn't even never be $1,600. But the flip side of this battle, price gouging and then insurance that don't want to pay. So the patient is usually stuck in the middle. We're usually given a lesser quality medication, and then we are forced to figure it out, fill in the gaps, make it work, do what it do, work it out. I have had to learn to be creative and resourceful to ensure that my health is well, because no matter how great and wonderful, I say this all the time, no matter how great and wonderful my medical team is, they still stay in business because of a chronic illness. But it is my job as my own healthcare advocate to find healthier alternatives that's not going to crush my budget, to ensure that I get everything I need to stay on top of chronic kidney disease and just live an overall healthy life. But it really does make me sick to my stomach to see the greed, the ridiculousness of some of these doctors, these pharmaceutical companies. It's like you have people who didn't choose to be in this predicament. It wasn't any fault of their own, but here they are battling a chronic illness, and all you can think to do is find ways to get rich off of them. It's just wicked. Evil and wickedness. That's all I can describe it as. Evil and wicked. That's exactly what it is. So yeah, so I am working with my medical insurance and my nephrologist to figure this thing out. Because one thing, I'm not paying $1,600 a month for a medication. But I'm also not going to allow them to give me some crap medication just because it's cheap. So I have a fight on my hands, but if it was brought to me, I'm equipped to handle it. And that's what I'm going to do. So it's your girl, Side Speaks. Living my life out loud as I battle and thrive with chronic kidney disease, as I pursue getting a living donor so I can kind of eliminate some of this, even if it's for a little while. And along the way, there's some hiccups, some bumps, some stumbles, but I thank God for the victories and the triumphant outcome, because I know in the end, I win and I come out amazing, and I know that you come out amazing. So do all that you can to live your life in a way that is on purpose, that's amazing, and you inspire somebody else to live their best life. And I like to say it's because of the love of Christ that makes all this possible. I know without a shadow of a doubt, if I didn't have God in my life, I wouldn't be able to handle needing a kidney transplant the way that I do. So I don't take any of this for granted. Thank you for every time you listen to my podcast, you watch a video. It helps because you're not only sharing my story, but you're helping to shed light on people in this situation or battling a chronic illness who may be in need of an organ donation. We can help dispel these myths that if you donate an organ, if you're in need of something, they're going to steal your organs, just all type of things. I really pray that something I say would just spark hope and light a fire up under you to, 1, pursue God with your whole life. 2, live your life on purpose because you matter. And 3, don't forget to reach back and bring somebody with you. It's your girl, Side Speaks. You're amazing. I love you, and there's nothing you can do about it. Until next week.